Finding 30% cost savings over 3 years, that's going to be a big challenge for all provincial government departments, but none will feel it more than the government's biggest department, Health and Community Services. Today, the Health Minister, John Haggie, discussed where he thinks those savings can be found. NTV's Michael Connors joins us live with details on that. Michael?
Thank you very much, Glenn. Well, John Haggie has the challenge of finding savings in the government's biggest department. Today, he said any program not producing positive health outcomes will have to go.
Ms. Kathy Bennett.
Last year's provincial budget provided for $3 billion in spending in the Department of Health. Finance Minister Kathy Bennett has asked all departments and agencies to identify 30% in savings over 3 years. That would add up to a $900 million cut for HealthCare, although that number is the absolute upper limit of what may actually happen. For Health Minister John Haggie, the big cost drivers in his department are clear.
From a healthcare perspective, 63% of our money goes out on salaries, and around 18 to 20% goes out on drugs. Those are the two big areas in which we would look to see how we can save some money.
Cutting healthcare professionals would be controversial, but Haggie says there is an imbalance in the kinds of healthcare professionals in the province.
And certainly at the front line, you'd be challenged to say we have more staff than we need. But looking at the system, we have a significant excess per capita of physicians, of nurses, RNs, nurse practitioners. Anything we can train and grow our own of, in actual fact, we have more of than the national average. On the other hand, if you look at those disciplines that we rely on out of province universities or training establishments, we're below the national average. So I think there's an imbalance.
Haggie believes there could be savings in patient-centered models of care that don't require patients to be treated by a doctor for every ailment.
You don't need to see a doctor every time you go with an ailment or an issue. A nurse practitioner, a physician's assistant, if we can get them. Maybe a midwife when the legislation comes through. RN, LPN, advanced care paramedics have worked extremely well in rural centres in Nova Scotia.
And as for services, Haggie says he'll be targeting programs that don't provide positive health outcomes.
Do they actually deliver? We've been very good at measuring process, but we've not been very good at measuring and documenting outcomes. I'm much more interested in looking at those programs where we've spent money and got nothing for outcomes. I'd stop those, quite honestly. Those need to go.
Minister Haggie recently attended a meeting of the country's health ministers in Vancouver. They were also discussing the possibility of a new health accord to get more money from the federal government, but the minister says ultimately that decision rests with the finance ministers and the prime minister. Glenn?
All right, Michael Connors joining us live. Thank you, Mike.